I put the picture over my heart so that I can connect the patients from the heart.
Because that it was at the very beginning of the COVID, the surge in New York, I'm sure that he didn't, he only saw people who were masked. He only saw people who were covered. I mean, the last thing he would have seen would have been not necessarily identifiable as human. And that just seemed really not okay. Warmth and competence are the two pieces that a provider needs to best activate the placebo effect, which is kind of the patient's own healing mechanisms within their own body. And so I could see really quickly that the PPE would come off as very competent, but there really would be zero warmth. And so I was really hopeful that the PPE portraits would replace the warmth that a patient would normally feel from a provider. There's a thing called post-ICU syndrome that has really negative impacts on people's lives and well-being. So it's basically like PTSD. And that one of the reasons that happens is because people get isolated in ICU settings, and isolation for humans is death. That's just all there is to it. They had very strict personal protective equipment guidelines, and people weren't able even to see the providers' faces. And as reports were coming out about the Ebola epidemic, Mary Beth heard people talking about a doctor had gotten sick, and he reported in his diary about what had happened that he spent the entire time that he was sick frantically studying his healthcare workers' shoes so he could tell who it was that was taking care of him, so he could connect with them at least inside his own head. So I remembered that. I was thinking about what I could do to contribute with COVID, and it seemed really obvious that with us needing to use protective covering, that we would want to have some way to connect. In addition to the impact on the patient, I think it has a really positive impact on healthcare providers and workers to sort of give them their humanity back, because they need to have the PPE to protect themselves, but it also strips them of their individuality and their ability to connect. We had one nurse working, and he said, it makes me feel like I'm more comfortable going to talk to a patient, like they're going to perceive it as less of a disaster zone. The whole point is to connect with the patient in a warm and caring way. And so, like, the bigger the smile, the more like straight on connection with the camera. You're trying to replicate the connection that you would have. I printed directly from my computer, just using regular label paper, 4x5 inch labels that you can get them. They come 4 to a sheet. You know, one of the main things at that point is to make sure that the PPE portraits, the stickers, are housed with the PPE and part of the donning process. So it becomes second nature to grab a sticker and put it on. It's just so straightforward, such a simple thing to do. Obviously a benefit for patients and providers. You know, I think the only reason not to do it is just if healthcare providers or the healthcare system are totally incapable of taking on anything more, and there are some places like that. That would be kind of the only reason not to try this out.